have so many people out there who are anxious and really struggling with worry, negative thoughts, negative chatter in their head. They're feeling really anxious, they're feeling panicky, and so many of us can't see it. So our lab, the Clinical Psychophysiology Lab, is really interested in understanding how we can use basic science about emotions and how people think and problem solve to better understand how people with anxiety and depression and trauma have difficulties in their lives. Some recent research that we've been doing to look at not only what do people bring to the lab naturally, but how might we change what they're able to do in the lab is we just installed a new treadmill where we have folks get on the treadmill to do some exercising before and after having them engage in some task to see can we use exercise or other movement activity to help people with anxiety and depression improve their ability to problem solve or think differently. In the lab, we have EEG machines that enable us to kind of look inside the brain in real time. And these things look like swimmer caps. They have little sensors embedded in them. And when people are presented with images that are really scary or really happy looking, what we see in the brain is these electrical impulses that you can see. They literally happen on millisecond time scale. We have folks come into the lab. We show them these really emotionally scary pictures that might remind them of a trauma or make them think about how they don't like their panic symptoms, like their heart racing. We show them those things in the lab. We record their brain activity. We then say, hey, let's take a break for 20 minutes. We're going to get on a treadmill. We're going to run for 20 minutes. Then after that, we're going to put you back in the EEG cap. We're going to have you watch these same sort of images again. We record your brain activity again. And what we're seeing in both of these studies is that after they run, when they look at those pictures again, their brain is just cooled off. When they see it for the first time, they have a really big emotional response in their brain. After they run, that emotional response just shrinks, by orders of magnitude. It's striking. You can see it right away. It really, what it's doing for us is it's quieting this emotional brain, because it's almost basically said, okay, you have all this stuff you're running through in your mind, this mental treadmill that you're running around and around these thoughts, and instead we're going to put your body into motion, and we get you to practice that, but exert and recover in your body, and it translates over to recovery in your mind. Psychology gives you the opportunity to be aware of that, to break it down, to put it into different categories like thoughts, feelings, and behaviors, and to give you some ideas of alternatives to try that can benefit both your mental health and your physical health, and just understand that those two things talk to each other all the time.